Hello everyone and welcome back to our channel Quaint. Today's topic is one that doesn't always get the attention it deserves. You have already seen the title, Nurse Burnout, the stethoscope's silent burden. You know, stethoscopes are carried by both the doctors and nurses, but here we are talking about only nurses' problems. So you have seen the special term burnout. Actually, stethoscope, this is the symbol of healing. But behind this lies a heavy, often hidden struggle. So question is, what exactly is nurse burnout? Nurse burnout, this is a state of physical, emotional and mental exhaustion caused by prolonged stress and overwhelming workloads. Yes, caused by prolonged stress and overwhelming workloads. So why we are saying, if you are not a nurse, then you don't know why we are saying that prolonged stress and why we are saying overwhelming workloads. Overwhelming workloads means what? Means there is a shortage of nurses in the healthcare system, whether it is a government hospital or private. Okay, there is a shortage of nurses. Adequate number of nurses are not there. Number of working nurses are less. According to the requirement, nurses are not there. That is the main thing. That's why overwhelming workloads they face very often. Not in all the hospitals, but in most of the cases, this thing happens. So this is one of the reasons. And we are talking about what? Prolonged stress. Yes, because they need to take care of critical patients, end of life situations. So emotional strain is involved because they need to take care of what? Not normal people, not healthy people. They are patients, end of life situations. They need to tackle. Okay, then that's why we are saying that emotional strain is involved. Again, they don't get proper breaks according to the requirement. They are also human beings like us. Okay, so they don't get actually proper breaks. They need to work long shifts. Long shifts means normal shift is what? It is 8 hours in our India. In other countries I don't know. In our India it is 8 hours. And we have already heard from many people that they need to work long hours. That means it is more than 8 hours. I don't know exactly whether it is 10 hours or 12 hours or more than that. But this thing happens. So all these things are what? Stressful things. And this stress builds up and causes burnout. So now you know the reasons behind this nurse burnout. Shortage of adequate number of staff, that is nurse, in the healthcare system. Then critical care case, end of life situations they need to tackle. That is one more thing. The lack of recognition means they don't get proper recognition. What they actually deserve, they don't get those things. They don't get enough time for sleeping. Okay, sleep schedules are very irregular. So due to lack of sleeping, what might occur that is known to you? At least you have the idea. So they face all these things, and most importantly, critical care cases and end of life situations. We are not talking about only one patient. Okay, we are not talking about only one patient. One nurse is taking care of only one patient. Not like that. Only one nurse may take care of so many patients, and it depends on the number of nurses in the hospital. Okay, or the nursing homes. It depends. But what we know that whatever be the nurses, whatever be the patients, but per nurse, if you calculate per nurse, what are the number of patients, then it is always more. More means they cannot tackle the number of patients so easily, and that's why these things become stressful to them. Okay, so what are the consequences? Consequences are what? This is very easy to guess. Since they already suffering from that burnout, that means that may lead to poor concentration in taking care of the patients. If concentration is not good, then what might happen? You have the idea of that thing. Without proper concentration, if they take care of the patients, means if they work in the hospitals, instead, in spite of having poor concentration due to their exhaustion, due to their burnout, so and then absenteeism that may increase. Okay, and there is a reduction of respect to that profession. That is also a chance. Even they may leave that job. Yes, they may leave that job. Means these things, these burnout, these overloads may push them to leave the healthcare system permanently. So these things might happen. But hopeful part is of course there, because worldwide the healthcare systems have already recognized this issue, means nurse burnout, and they have started taking care of this situation, critical situation. No doubt this is a critical situation. That means they are doing what? They are encouraging peer support groups, then counseling, then mental health support. They are trying to increase the number of nurses in any hospital. And the same way they are trying to reduce the workloads. If number of nurses increase, then workloads will be reduced. That is obvious. Okay, and most important thing is what? Most important thing is they should be truly valued by us, not just by words. You are so good. This is not enough. Okay, you are so kind. If you say to a nurse, you are so kind, that is not enough. Means our words are not enough to give them true values for their contribution to our healthcare system. So what should we do? What should we do? Okay, we should do all those things by taking proper actions. Okay, by making good policies, useful policies for them. Okay, you know, policies are there. So many. If you have the experience of doing job, then you know policies for the employees are there. These are followed by companies. Similarly, for the nurses, we need to frame different useful policies for their benefit. So this is what? This is a kind of recognition. Okay, they are truly valued. How they will understand all these things? They are truly valued. They are so important in our healthcare system. Without them, healthcare system will be destroyed. Only doctors are not sufficient. Anyway, that thing will be discussed in separate video. What is the difference between doctors and nurses in any healthcare system? But just keep in your mind that doctors are not sufficient. Okay, for the purpose of healing, doctors are not sufficient. They prescribe medications, but okay, surgeries are done by them, but that is not everything. Okay, without nurses, healthcare system, there is actually no existence of healthcare system without nurses. They are so important. They are so important. Without them, we cannot even think of about any healthcare system, means good healthcare system or healthy healthcare system. Anyway, so many things are there. Okay, and one more thing, at individual level, they can practice, means nurses can practice many things, and that way, many things means what? Like mindfulness, taking self-care, then deep breathing techniques are there. Okay, and strong social connection. Strong social connection means they should build up strong social connection. And for all these things, their workloads must be reduced. If they don't get any time, then how they practice that mindfulness, that deep breathing techniques, they are not getting time for sleeping. If they are not getting time for sleeping, proper sleeping, okay, then if they are not getting time for proper sleeping, so how can we think that they will try for mindfulness, deep breathing exercises, social connections, etc.? For all these things, sufficient time is required. That means we need to reduce their workloads, reduce their that time, means the duration of working in their hospitals or nursing homes, etc. Okay, means long shift hours. I have already mentioned in the very beginning of this video, long shift hours. We need to reduce that long shift. Anyway, so many techniques are there. So if the nurses practice all these things like mindfulness, deep breathing, etc., in that case, that does not directly reduce that burnout or the effect of burnout, but that actually is the problem. That may is the problem. Better to say this way. That may is the problem. Anyway, so this was all about today's topic, and this is the end of this video. If you found this video helpful, so please like, share and subscribe to our channel. This is the end. Thanks for watching.